Hi, Paul Slack. Goodness Planet. I'm speaking to Dr. Alexis Abramson. Hi, doctor. How are you?
I'm fantastic. How are you today, Paul?
I'm very good, and I'm so excited to speak with you. Our community is quite large, over 50 community, in that we're partners with a Senior Net organization, which has been around for 26 years, helping seniors learn how to use computers and the digital divide. And Dr. Abramson is, I love this, impassioned champion for the dignity and independence of those over 50. Plus, you're an award-winning Emmy Award, Gracie Award, and so on and so forth. So, and you're going to tell us some very important information today about Medicare Part D. And so, thank you very much for being on our show.
Oh, I appreciate your having me, Paul. I'm looking forward to it.
All righty. So tell us, okay, well, first of all, I guess what is Medicare? Let's start with that.
What is Medicare? Wow, Medicare is an overwhelming maze, but Medicare is basically the program that the government has allowed us to use for our 60-plus population and those under 65-plus population, and those under 65 that are disabled and do qualify to be able to have great health care in our country.
Okay, so we have this. It's a government program. And though there are lots of bits of information that we need to know to be able to receive it and to receive it properly and wisely?
Well, there's tons of information. So as we know, there's A, which has hospital coverage, B, which is doctor's coverage, and C, which is sort of a all-around coverage. But the thing I'd love to talk to you about and give you some tips on today is Medicare Part D, which is actually the prescription drug coverage part of it.
Okay.
So if I could, I'd love to, just sort of launch into three of my favorite tips that I think are just super important. And the first one is sign up. Paul, that's the most amazing thing to me is listen, we're in the middle of an annual open enrollment time, which is now between December 7th. And a lot of people, I think they just, think that when they wake up at 65, they're automatically enrolled in Medicare or Medicare Part D, and the reality is no, you've got to actually go and sign up. And if you're a caregiver, for instance, get your aging loved ones to make sure that they sign up. A great place to go for that is Medicare.gov. They have all kinds of information that they can give you and resources. So in the second place, the second really important tip that I think is to make sure you research the plan. So a great plan out there is the Humana Walmart Preferred RX plan. And for instance, if you go on that website, which is walmart.com/RX plan, then you can put your zip code in and you can find out whether they carry your prescription or not, and whether, what the costs are and sort of the long-term values and benefits. And then the third thing that I would say is that just to make sure that you locate plan finders, because plan finders will give you all kinds of information. And again, you can go to the websites I mentioned earlier and they'll allow you to do that with ease. So all the resources are out there, and the 800 numbers are out there too if you'd like me to talk about those.
Okay, sure.
So for Medicare.gov, the 800 number is 800-633-4227. And the 800 number for Humana Walmart Preferred RX plan is 800-899-0441.
All right, you're about information. There's no doubt about it. Now, I did go to that the website here, the Walmart website, Humana Walmart Preferred RX plan. Okay, so in essence, the Medicare Part D prescription aspect of the government. I don't know whether we call them entitlements or not, but what we are allowed to get. What does that actually mean? So say a prescription is $100. Say we don't have we don't have prescriptions as part of a plan that we might have now. How much does the government pay, and is it the same for everybody?
Well, no, so that's a great question. So we were referring to the Walmart and Humana plan. So for that plan, it's very innovative. It's $4 for any generic drug that you would need. So you can go on and find out if they carry your drug. So I mean, that's amazing. You talked about as an analogy, $100 fee for a drug, but the reality is with the Walmart plan, it's $4. And actually, they just announced something that's so innovative and interesting to me, which they claim that the majority of mature adults, up to 70%, the CDC says, has hypertension or high blood pressure. And Humana and Walmart actually just launched a program together where it's only a penny for the top 10 drugs that are drugs for hypertension if you're a member of their Medicare Part D plan. So that's just amazing to me, because we're all always so freaked out and concerned about what's it going to cost. If I get a chronic condition, I'm sure you know this, Paul, but in 2020 they're projecting that over 80 million people over the age of 65 will have 2 or more chronic conditions. So when you're thinking about chronic conditions and medications to have a very high quality life, it's really important to make sure you match a plan to your potential chronic condition. And so this is a very, very serious subject, and it's very important that people make sure they take that seriously.
Oh, we couldn't agree with you more so. And it's a very serious subject, not only for the, let's call them the person who's 65 or over, but it's also a very serious subject for their children, if they're so lucky to have.
Absolutely. And
because
then the children
we're all in it together, right? I mean, now, what do you do? You're not going to let your parent not get hypertension medication that can be helpful for them, right?
Yeah, and I think that's such a great point that you bring up. For the caregiver, a lot of times the mature adult may not take the initiative themselves to go out and get these plans and make sure that they research these plans. So it is on the onus of the caregiver a lot of times to make sure their aging loved one does, because otherwise it's going to hit the financial pocket. I mean, you look at some of these drug costs. If you're not covered by a plan such as the Humana Walmart preferred plan, then you're going to land up in a situation where you really cannot afford basically the drugs that you need at times.
And who are our grandkids going to play baseball with?
Yeah, that's right. And the great-grandkids, please. It may be such that the grandparents, the great-grandparents, and even the great-great-grandparents are all on Medicare Part D one day. We're all hoping so. It's job security for me.
Why do I have so many cramps today after seeing my grandkids? That's what I want to know.
Absolutely.
So it's all good. So this is very important information, no doubt about it. And so step one, what do you say? So Medicare. So let's say let's just get to the one that's just turning 65. But you say that by December 7th. Say that again to our audience. So
on December 7th, what happens is what they call the annual open enrollment period, just like a person might have had when they were, during their working years, or possibly still if they're not retired. The open enrollment period ends. And it's really important to make sure that you sign up prior to the end of that, which is December 7th this year. Because if you don't sign up, you will have a penalty attached to your fee when you do choose to sign up. So it's very, very critical that you do that before December 7th.
Okay, that's the good news today. We want to inform our communities and the communities of their friends and family and so on and so forth, so everybody knows about that. Well, you do a wonderful job, Doctor. Thank you very much. How come you pursued this field?
I have such a tremendous amount of passion for mature adults. I had the most amazing grandparents, and I feel that if I can be a change agent, even in just a little way, to make their lives better, and then it's going to make mine better when I'm in my 60s and 70s.
You're a nice person. Then the last question is, what's good news for you?
Good news is talking to you, Paul. I've had a great time. Thanks for having me on.